9:42, good morning and welcome back. On the Health Watch, Northwestern University just launched a new research center aimed at addressing the youth mental health crisis through early intervention.
The new center is part of the university's Institute for Innovations in Developmental Sciences, and it's being funded with an $11.7 million grant from the National Institute of Mental Health. And joining us now is Dr. Laurie Wakschlag. She's the director of Northwestern's Developmental Sciences Institute and a professor at the School of Medicine. We really appreciate you being here.
Good morning.
Good morning. Now, the main goal of this new center is to spot the signs of a potential mental health condition or disorder early in a child's life. So let's start with what some of those early warning signs are.
An emphasis on early warning, so we're not talking about diagnosis. We're introducing a new mental health vital sign for toddlers, which is irritability, or most importantly, temper tantrums. Now, before parents panic, I'll just say we expect toddlers to have temper tantrums, but when they are intense, very frequent, and hard to redirect over a period of time, it indicates a reason to look at risk.
And you also mentioned difficulty making friends and frequent, intense, you said tantrums, and then the irritability, much of the time, right?
Tantrums are the most common expression of irritability, easily recognizable, a frequent presenting problem to pediatricians. Parents and teachers know it when they're worried.
Okay, good to know. And also, what mental health issues are you focused on here in your study?
Well, in early childhood, this mental health vital sign is a general, a child is at risk for developing the common mental health problems of childhood: ADHD, oppositional problems, depression, and anxiety. So it's a marker to many things, and it helps us gauge it efficiently because we only have to look at the one thing in the context of the family and development.
Oh, that's helpful.
So what sort of tools specifically are you giving pediatricians to look for these markers, and if they spot them, what are you telling them to do?
Well, the exciting thing about the center is it's essentially introducing precision medicine into pediatrics for the terrible twos. We're trying to break through the gap between what science knows and what pediatricians are equipped to do. We will be using a risk calculator like you might be used to for cardiovascular care and adult primary care that centers on irritability and also takes other strengths and risk in developmental and family context. It will give the pediatrician an individual's child risk, the probability that that child will develop childhood mental health problems, and then the pediatrician will discuss with the family whether they would like to participate in an online prevention to support the family in helping the child manage their feelings and behavior better, and they don't even have to leave their living room for that.
And just to back up a little bit, let's talk about the importance of equipping pediatricians, because I was thinking about a family who may not go to a mental health expert, but they might have a regular visit with a pediatrician, right?
You are spot on, and the secret sauce of this center is it's leveraging a relatively new field, implementation science, which is basically nothing about us without us in terms of the real people who will be affected by the research. We in the center are partnering with 3 pediatric health centers, Alliance Chicago and Lurie Children's Hospital in Illinois, and Nemours Children's Health in Delaware, and they will be co-designers and partners in the research. And it will be there to give them this risk calculator and these preventions and these tools so they can feel confident and effective in identifying when to worry about young children's mental health. There's over 10 million 3-year-old children with an identified mental health problem in the U.S. There's 95% of kids who see their pediatricians.
And let's talk about, again, the importance of early detection is, of course, because then you can get early treatment, early therapies, correct?
Correct, and we'll be offering those therapies. And often people think, oh, they'll just grow out of it, and they wait. And as you were just talking about, this is an optimal period for brain and behavioral development. Let's catch it. We have to start earlier.
Right, okay.
Yeah, it's so helpful to have more tools. And I just think, like, growing up, we just didn't know a lot about mental health and the importance of it. So thank you for sharing it with us and coming on the show with us.
We really appreciate it. Keep us updated. Thank you so much, Dr. Laurie Wakschlag. We appreciate your time. Sit right there, though. You don't have to leave quite yet. You can learn more about the new center by heading to Northwestern's website. Search under the Institute for Innovations in Developmental Sciences. Laura?